Hi everyone, I'm Dr. Karen Leong. This is Baby B. We are part of the Face and Body team, and we are starting off a brand new kind of bi-weekly, is that right? Twice a week series between Dr. Park and myself, just discussing different plastic surgery topics. And we wanted to start off because it is Breast Cancer Awareness Month, and we love women with a MomBod 360 topic. So welcome. I hope you join us every Monday and Friday. So we're gonna try different times out to see what works best for people. Right now we're starting with the noon. So trying to catch people if you're a stay-at-home mom, maybe between meals or nap times, and if you're working on a quick lunch break. So I just wanted to start off by saying that Dr. Park and I and the whole Face and Body team, we believe in your kind of how beautiful you are as a person. It doesn't necessarily reflect on the outside because obviously, whoops, she's escaping 1 second. Obviously, after we have children and with age and weight gain and loss, a lot of things happen to our bodies that we may not be that comfortable with, that proud of, that willing to show off. But we do totally, completely, absolutely endorse being natural, loving yourself, loving your body, whether you're loving it in the condition that it's in now, or if you're saying, hey, I think I need a little bit of help. I have some goals in mind. I have a dream I really want to achieve. What can you do to help me? Okay, you go crawl around, all right? I'm gonna work. 1 sec. So I was looking online recently, and there is this really amazing kind of art exhibit project called Life After Birth. And what they've been doing is they've been collecting submissions from women around the world of their postpartum bodies. So the way that their bodies look immediately after birth, months after birth, years after birth, after multiple births, after C-sections, you name it. And they compiled this collection of photos and stories from everyday women and also from celebrities, just showcasing the changes that happen to their bodies once they have children. And I know it's really kind of, I don't know, it's hard for me to look at magazines of these beautiful models after they have kids, and I'm like, that's really not realistic. You know, we have so many moms who come into our office and they're hiding themselves behind Spanx and girdles and long sleeve tops and push-up bras because their bodies aren't what they used to be before they had kids, or maybe they never were that way, and then having kids just made it that much harder to bounce back. So when Dr. Park and I put together this Facebook Live series, we really wanted to focus on mothers. And since I'm a relatively new mother myself, I'm feeling for the first time in my life that I can empathize and sympathize with everyone out there. I do have to admit, I think I've been luckier than most. My body has bounced back pretty well. She's 6.5 months old and I'm 38. So starting off a little bit later with a geriatric pregnancy, and wasn't sure what to expect, but came out okay. Obviously there are things that aren't ideal, and to be really honest, I've always been really proud of my body. I've worked really hard at it. I've been really fit. And then I was pretty hesitant about pregnancy, about having children. It never really had a place in my life plan, but you know, my husband and I had talked about it. We prayed about it. People at church prayed for us just because I was so unsure, and he really wanted children. He's a pediatrician. So we finally had her, and she's pretty perfect. She's a great baby, and I still can't say I'm like, oh my God, babies, yay, yay. I'm not like that, no. But I do love her, and she's so lovely and so much fun. Okay. She just started standing up and crawling, so she's getting into everything, and every once in a while we have a little head boink, but you're okay. But anyhow, like I was saying, it wasn't really in my life plans, but I was fortunate enough to have a really easy pregnancy. I elected to have a C-section just because I treat a lot of women after birth, and I just didn't really want to do that to my vagina. So I live in the OC, and we call it the OC vaginal bypass, so I elected to bypass. Again, this was a completely personal choice, and I have no criticism or judgment or feelings any which way. This is your personal journey, and you have to do what's best and what's right for you. But this little nugget came out, and she's pretty awesome. But I kind of just feel like myself, but with a extra little perfect little person right here. Okay, so when we're talking about MomBod, we're talking about a 360 change nowadays. It's not just the standard breast and tummy that traditionally we think of when we say MomBod. Nowadays, we take each person into account. We, during our consultation, we talk to you and we ask you what your goals are, what your dreams are, and what are the things that you've noticed that have changed that you would like to restore or rejuvenate, or if they're just things that you're like, hey, this wasn't like this before, what can I do? So nowadays, when we talk about mommy makeovers, we kind of talk about it from head to toe, front to back, all the way around. In this series, I wanted to break it up by the different areas just because not everyone has the same concerns, and you can just check in and follow along on our videos when an area of interest comes your way. So for me, I think about what happens after pregnancy when everything has become very elastic and you're expecting it all to shrink back in. And obviously over the 9 months with a lot of weight gain, what's happening is we have increased elasticity so that our hips widen, our pelvis stretches, our abdomen distends so we can accommodate this fetus. And then once we've given birth and everything's come out, the body's expected to kind of revert to what it was before, but it never is exactly the same. Some things will never come back. For me, I actually have hips for once in my life and kind of breasts, not really, but it's better than it was before. So in some ways, this has been a blessing. But in other ways, what I hear a lot, I'm part of a new mom school and mommy groups, and I live in a neighborhood with lots of young kids and moms, and all of us kind of complain about the same thing. We've noticed like deflation in our faces, our skin gets drier as the hormones kind of fluctuate. We might have fat underneath the chin here that is just like so stubborn, I can't get rid of it even though I'm dieting and exercising. I've noticed that from breastfeeding, my nipples are not the same anymore. They're longer, they're like sandpaper, they're more sensitive, they're darker. My breasts, even though I'm saying they're bigger than they've ever been in my whole life, for others, they deflate. So what used to be high and perky and full are now sitting lower, might be on your abdomen. Nipples might be pointing down, might have lost a lot of upper pole fullness, might just have a lot of stretch marks that you don't like. And you're pouring yourself into a bra and trying to hoist them back up, but you wish there was something you could do. And of course, there's always the tummy. That includes, lipodystrophy, which just means abnormal pockets of fat, whether it's in the bra area or even in this little bra fat area around the tummy, in the flanks, in the upper back, in our outer thighs and hips, in our inner thighs, you name it. It just likes to stick there. And, now we have less time to work out. We have less sleep. We're probably not eating as well as we used to because all of our extra time and attention are going to our babies. So there are things that we can do and there are things that we need help with. And that might include liposuction or non-surgical, such as cool sculpting. It may involve something more aggressive, such as tummy tucks, and we'll talk about that. There are different levels of tummy tucks, from minis to standards to skin only to extended to full body lifts. And then, for someone like me, where I had abs and I loved my abs. And now I notice that my muscles have not come back together. And even though I suck myself in all the time and I'm wearing leggings, if I let myself out, there's a pooch and I hate that. What can we do about it? And also another thing for myself, which I had a little one before, but now definitely do. I have a hernia in my belly button. It just kind of pops out and it won't go back in. I was hoping that would heal and it would go back together, but it hasn't. So, there are ways that we can fix that too. And then we're talking about, kind of our lower body. We're looking at our bottoms. It used to be nice and tight and round. Now might be starting to deflate or just have been very flattened. You may notice that there are hollows and divots on the side of your hips, kind of like mine, that either were always there or weren't there before. You may notice saddlebags on the side of the legs or when you're looking at your inner thighs. And these are things that we can either work on, again, by cool sculpting or liposuction or even some skin tightening if there's really a lot of extra skin. For me, myself, because like I said, I work with a lot of women after they have children or after massive weight loss, or even, just genetically they were born this way. Some things that do tend to bother others, especially, again, if you're wearing leggings, is the labia and the vagina. And that's another area we can discuss if that's something that's interesting to you. So basically the idea of this Facebook Live is we'll tackle a topic and a body part and a procedure. And what I would really love is if you would chip in with your comments and your questions. Anything is welcome. There are no silly or stupid questions. And if I can't address them right at that moment, we will get back to you very shortly. Just go ahead and type your question in there, or direct message us at Face and Body Cosmetic Surgery. Or, if you're kind of like, I just want to talk to you, I can also be reached at Dr. Karen Leong, either through Facebook or Instagram. But I wanted to welcome everyone to our Facebook Live. We're trying to keep it a little bit informal, and Dr. Park and I will cover different topics. So of course, if you also have a preference and you really want to say, hey, Dr. Park does amazing breast lifts and I've seen him on Instagram, they are so good, I really want him to cover that topic, would you please? Then absolutely, just let us know and we will nab him and get him to do it. Hi Jenny, thanks for joining us. So that's kind of the way this forum works. Again, if you have a chance, take a look at that Life After Birth kind of art collection. They also have an Instagram, but it's really powerful, I think. It addresses all the little nitty-gritty changes that you notice that everyone tries to hide. And really, we are more than 50% of the population in the world, probably more. And my daughter will go through the same thing, so why are we trying to hide it? I hope that she will be completely comfortable in herself, and I hope she knows that if there are things that make her less or more self-conscious and less self-confident, that she can come to me about them. And I do not necessarily endorse my daughter having surgery, but if she really wants it, we can sit down and talk. Anyhow, so I think that might do it for my time today. But again, for the MomBod 360 series, I would like to cover a different part of the body and kind of the different options that we have. So if you're interested in those, please check in with us and follow those videos. We will be posting the topics each week, and like I said, right now we're trying this noontime hour, but if there's a different time that you would prefer, please do let us know, because we want to be available to you all. We will be posting these videos onto Facebook so that you can always access them if you do happen to miss a session. And like I said, we are at your disposal. Please message us, come to the office and visit us, follow us, and become part of our family. Oh, one more thing. We do have a med spa event coming up next Thursday, October 17th. It's called the Shed the Dead event. So it's a perfect time of year to kind of buff and shine and get rid of all that dead, dry skin. Winter is coming. Yes, Game of Thrones reference. But we can all do with a little pick-me-up before the new year. So what it is our med spa is putting on their annual event. It'll be kind of fun, kind of a Day of the Dead theme with makeup and a lot of spa specials. So it's a great time to stock up on your neurotoxins like Botox, your fillers. We have amazing specials, and then the lasers and facials and all kinds of goodies. So call in 909-981-8985, make your appointment. We are doing treatments the same day, or else just come in and talk to us, have a little bit of fun. So again, that's Thursday, October 17th. So I will see you all next Monday. I think baby B has reached the end of her patience here. So we will say goodbye, and thank you for joining us. And please stay tuned for next week's topic.